Hello everyone. So today in this video we are going to discuss about the radial nerve, the course, the branches and the clinical anatomy related with the radial nerve. So as you know, radial nerve is the largest nerve of the brachial plexus and it is actually the continuation of the posterior cord of the brachial plexus. It is formed in the posterior part of the third and second part of axillary artery and the root value is ventral primary rami of C5 to C8 and T1. After forming in the axilla, it is passing through the lower triangular spaces and it will enter the back of arm. When it is passing through the lower triangular spaces in the axilla, it will give two muscular branches and one cutaneous branches. Two muscular branches are to the long head of triceps and to the medial head of triceps. And the cutaneous branch is to the posterior cutaneous nerve of arm. After passing through the lower triangular spaces, it will enter the back of arm and it will enter the radial groove. It will run in the radial groove along with profunda brachii artery, right? And when it is running in the radial groove, it will also give two muscular and two cutaneous branches. These branches are two muscular branches are to the lateral head of triceps and to the anconeus. And then it will give two cutaneous branch to the lower lateral cutaneous nerve of arm and the posterior cutaneous nerve of forearm. So it will supply the lower lateral part of arm and posterior part of the forearm, right? So in the back of arm it is giving this two branch in the radial groove. Then it will pierce the lateral intermuscular septa and it will come in the front of arm. In the front of arm, the radial nerve will give three muscular branches to the brachioradialis, to the brachialis and to the extensor carpi radialis longus. Now as we know, brachialis muscle is supplied medially by the musculocutaneous nerve, but laterally the proprioceptive fibers of the brachialis muscle are carried by the radial nerve. So it is in front of arm, it is supplying the brachioradialis, brachialis and the extensor carpi radialis longus. So in the arm actually, the radial nerve is passing through the radial groove and then it is passing in the front of arm, right? After passing in the arm, it will come in the cubital fossa. In the cubital fossa, it is the most lateral content of cubital fossa, and in the cubital fossa, it is dividing into two parts, two branches, the deep branch and superficial branch. They are the two terminal branches of the radial nerve. Now let's talk about these two terminal branches. The superficial branch of the radial nerve is the cutaneous branch. This superficial branch of radial nerve, it is the cutaneous branch and it is passing in the back of arm, it is passing in the back of forearm, and lastly it is ending in the anatomical snuff box. Near the anatomical snuff box, it is passing to the tendon of brachioradialis, abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus. It is the content of the anatomical snuff box, and lastly it is giving the cutaneous innervation to the lateral half of dorsum of hand and lateral 3.5 fingers on the dorsal side, except the nail bed, because the nail beds are actually getting supplied from the median nerve. Okay, so this was about the course of superficial branch of radial nerve. Now in the cubital fossa, the radial nerve is also giving another branch, that is the deep branch of radial nerve. Another name for this branch is posterior introitious nerve. So now the name of radial nerve is now changed to the posterior introitious nerve. The posterior introitious nerve will first pass from the two heads of supinator muscle, and after passing through these two heads, it will supply the supinator muscle, and then it will give the muscular supply to all the muscle of back of forearm except the extensor carpi radialis longus and the brachioradialis, because these two muscle of back of forearm are already getting its supply when they were the radial nerve in the arm, but the posterior introitious nerve is supplying all the muscle of back of forearm except two muscle, extensor carpi radialis longus and brachioradialis. So let's see which muscle are getting supply from the posterior introitious nerve. They are the supinator, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. So these four muscles and brachioradialis, anconeus and extensor carpi radialis longus, these seven muscles are superficial muscle of the back of forearm. And then we have the deep muscles. Which deep muscle we can see? Abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis, extensor indicis and supinator. These are the deep muscle of back of forearm. So all the muscle of back of arm and back of forearm are supplied by the radial nerve. And lastly, this deep branch is also giving articular branch to the inferior radial ulnar joint and to the wrist joint. So we have talked about the course and the branches of radial nerve. We talked about the four kind of branches of radial nerve, MCAT. We talked about the muscular, cutaneous, articular and terminal branches. As we know the branches and course of radial nerve, now let's talk about the injury to the radial nerve. The radial nerve can be injured at three sites. It can be injured in the axilla, it can be injured at the spiral groove or at the elbow. Let's talk about the first scenario. The radial nerve is injured in the axilla. The causes are due to crutch palsy or due to Saturday night palsy. If the person is using the crutch in abnormal way, the person can have crutch palsy or the Saturday night palsy. If a drunken person on the Saturday is sleeping on the chair by hanging his arm on the chair, the person can have the Saturday night palsy. So let's see what happen. What will be motor loss and sensory loss if the person is having injury of the radial nerve due to injury at the axilla? So there will be total loss of radial nerve, total function of radial nerve. So there will be loss of extension of elbow due to loss of triceps muscle, right? So there will be loss of extension of the elbow. There will be also loss of extension of wrist. So there will be wrist drop, okay? And also due to paralysis of the supinator muscle, the person will not be able to supinate his forearm in the extended position because the supination in the flexed arm is done by the biceps brachii muscle. So the motor loss will be the wrist drop, loss of extension of elbow due to paralysis of triceps brachii, and loss of supination in extended arm due to paralysis of the supinator muscle, okay? And the sensory loss will be due to the injury to this all the nerves, the posterior cutaneous nerve of arm, posterior cutaneous nerve of forearm, the lower lateral cutaneous nerve of arm, and the superficial branch of the radial nerve. So there will be sensory loss to all this area, to the arm, forearm and hand. If I have injury at the spiral groove, the causes are what are the most common cause is the mid shaft fracture of humerus or wrong intramuscular injection. So there will be injury in the spiral groove to the radial nerve. So now let's see what will happen. If I have injury here, right, this is the place, this is the most common site for injury of radial nerve at the spiral groove. So now try to understand, the triceps brachii are already supplied by the radial nerve, but I have injury at this part. So there will be no loss of extension of elbow because triceps brachii are intact, but there will be wrist drop because all the muscle of back of forearm are lost, are paralyzed. Now the motor loss will only be the wrist drop and the supination loss because of paralysis of these muscles, and the sensory loss will only restrict to the hand because the back of the posterior cutaneous nerve of arm and forearm are already given in the axilla in the spiral groove. Now if I have injury at the elbow, what will happen? The most common cause is the fibrous band we are using at the elbow in the cubital fossa. So there is posterior interosseous nerve entrapment. So let's see what are the motor loss. So there is no wrist drop, but due to paralysis of the some muscles of the back of forearm, there will be loss of extension at some extent, okay? So this is the motor loss if I have injury at the elbow. The sensory loss is related with hand only because of superficial branch of radial nerve, right? So these are the injury to the radial nerve and its three causes, okay? So now we have discussed about the course, branches and the clinical anatomy of the radial nerve. Now let's revise the course and the branches of radial nerve once. So now radial nerve is formed in the axilla, and after getting its formation, it is passing through the lower triangular space along with profunda brachii artery, and then it is piercing the lateral intermuscular septa. After piercing this lateral intermuscular septa, it is coming in the front of arm. In the front of arm, it is giving also some muscular branches. Then in the cubital fossa, it is the most lateral content of the cubital fossa. It is dividing into two branches, the deep branch and the superficial branch. The deep branch is known as posterior interosseous nerve, which is the totally muscular branch, which will supply all the muscle of back of forearm except the brachioradialis, extensor carpi radialis longus and the anconeus. And the superficial branch is supplying to the back of hand, the dorsal half of the back of hand and dorsal 3.5 fingers except nail bed. So thank you so much. This was about the course, branches and the clinical anatomy of the radial nerve. You can use this video for your understanding purpose, and if you have any doubt, please feel free to ask me in the comment. And if you enjoyed the video, please like this video and share this video with your friends, and also subscribe to this channel. Thank you so much.